La Clínica's patient population is primarily Latino immigrants. Almost 90% of our patients identify as Hispanic origin. 85% of our patients do not speak English as their first language. We serve a large chronically ill population. Hypertension, diabetes, and HIV are our top diagnoses. We have about 500 patients with diabetes and many, many more who are at risk or in that pre-diabetic stage. Addressing the social determinants of health is not just a good thing to do, it's the only thing that we can do to be able to achieve the health outcomes that we all want. Frequent barriers that La Clínica del Pueblo patients experience are health insurance access, language access, culturally competent care, affordable housing, legal services, food access. Having a safe space where people could come and get services in their own language from members of the community or providers that understood the context which they came from was really the main reason to create La Clínica in the first place. And it's minutes away from many other community-based organizations that we partner with, as well as the food market and pantries that are specific to our Bridging the Gap project. I've always thought of La Clínica as part of our community's wealth. Several years ago, we were fortunate to be able to inhabit the La Casa space, which we've been able to develop it as our community health action space. It's rather been a health project of a community arriving here and creating its own community structures. La Clínica very intentionally hires health educators who are community members. Navigation is really key to be able to do something beyond what you can touch.
Trabajo con pacientes que viven con diabetes, con pacientes que son prediabéticos, colesterol, presión alta y otras enfermedades crónicas. Y me enfoco en dar educación individual, en cómo adoptar cambios en el estilo de vida y cómo manejar o controlar la diabetes. Es gratificante para mí saber que ahora puedo ayudar, que tengo la oportunidad de ayudar a mi comunidad, ya que yo también pasé por ese proceso al llegar en este país. Al no tener alguien que les ayude a navegar es más complicado, se vuelve más difícil para nuestra comunidad, pero ahora sé que yo puedo ayudar. La Clínica del Pueblo hace conexiones con la comunidad por medio de redes, por medio de alianzas, por medio de ferias de salud y por medio de conexiones y contratos y asociaciones que hacemos con otras organizaciones en la comunidad. Los pacientes se sienten bienvenidos, se sienten muy apoyados porque ellos a veces vienen por una situación, pero nosotros nos conectamos con los demás servicios que tiene la clínica. Entonces es como en un lugar ellos encuentran muchos servicios y eso les hace sentir muy bien, ya que no tienen que estar yendo a otros lugares por servicios que pueden recibir en el mismo lugar, donde hablamos el mismo lenguaje, les hacemos sentir bienvenidos y en confianza.
Y mucha gente que están aquí han mirado el resultado de estas charlas que nos dan los promotores, la alimentación, todo eso, cambia a la persona, cambia. Se preocupan por la persona, por el paciente. Ellos miran que supere ese problema. Y así es para todos los servicios comunitarios que tenemos, comida, esos bancos de comida, el mercado, que con esos servicios que tiene comunitarios es una maravilla.
My hope is that we'll be able to resolve the health access for immigrants in this country and understand that public health doesn't work if it doesn't work for all. Bridging the Gap lets us bring our work around community health promotion, wellness, integrated team-based care, learning, education, and cultural competency together. And we have also been able to integrate more screening around social determinants in a standardized way. My hope for the future is that our health sector will continue to evolve in the direction that it's going in its best form, which is to understand that health is not just the absence of disease, that health is broader than healthcare, and that to produce health, we need to address not just what happens in our body or even in our local environment, but the structures that we create to live, work, and play.